Patient walks in your office, they have osteoarthritis in a joint. What do? Of course, you're going to have conservative measures first, but what happens when that patient doesn't do better? What are your options with joint degeneration as far as symptomatic relief? Hey, this is Brandon Steele with ChiroUp. I want to bring up 3 options that some people use for symptom alleviation. The first, we're going to use injections. The injections are the #1 thing that is going to be deemed as conservative, non-invasive. Patient comes in your office with joint degeneration. Let's call it hip osteoarthritis. You do what you do. You do everything you know as far as conservatively and manual therapy, manipulation, modalities, rehab, and they still have pain. What else is at your disposal? Hey, this is Brandon Steele with ChiroUp. I'm going to explain to you the 3 options as far as injections that we have as manual therapists to send our patients to for hopefully to get some symptomatic relief to help them on their journey of healing. #1, the most common is going to be corticosteroids. I am surprisingly not a big fan of this. I like sending people to multiple providers, but however, corticosteroids can help with some pain relief. However, they're going to accelerate the rate of degeneration, and they just don't give the symptomatic relief that I find with most of my patients. These patients have a chemical problem, not a mechanical problem. Now, when it comes to our orthobiologic injections, our PRP injections, regenerative blood product injections, it makes sense in the lab. We've seen some good results. However, what we're seeing as far as the research is our weight-bearing joints, our big joints, aren't getting the same positive results as the small joints like the elbow, like the hand. So I don't use those for a lot for our hip injections. However, a new paper just came out as far as injecting them with saline. If you inject with saline, you get the same results between 2 and 6 months than you do with anything else as far as corticosteroids or PRP injections. So why is that? That's what really begs the question, and I don't have the answer to that. However, I do think there is a component of it that is just placebo, because what we find is that you still have to do a physical procedure. You have to inject the patient with something. The patient believes they're getting better. Maybe it's more fluid in their joint. Maybe it's just the thought of getting better. I'm not sure. But here's what I can tell you. If you can do mechanical treatments to your patients, whether it's an injection, whether it's using your hands, whether it's a combination of those, it's usually a recipe to get these patients better. And what I can tell you from this last study is it's probably not what you're injecting in the patient that's getting them better. It's more about the recipe. It's the manual therapy. It's teaching them how to sleep in a better position, how to get some more exercise, how to use a descending inhibitory pathway with those hip and knee patients to get them to walk better, to exercise. Find those movements, find those activities, find those things they can do and focus on that. Don't focus on the things they can't do, and don't focus on things that don't work. So the next time you have a patient that's not getting better, don't be afraid to send them off for injections, but don't have the patient rely on those therapies to get them out of pain and keep them out of pain. It's what you do as a manual therapist and what you do as a doctor that's going to keep that person out of pain with the education and the things that you do in your practice, not depending on medications or injections.